Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. As usual today, I'm starting off by wearing my mask to cover both nose and mouth, but I'll take it off for us to continue this conversation. Remember, if you have any questions or comments about the COVID-19 pandemic, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Well, we continue now our discussion around the COVID-19 pandemic. We're now into the third week of May 2021. And within the last couple of weeks, we have seen in this part of the world, in this region, between Guyana, Suriname, Trinidad and Tobago, just within this month, we have seen hundreds of people dying from COVID-19 in these three countries that represent the Southern Caribbean in CARICOM. This is indeed devastating to us as a people, and we continue to try and fight against all of the conditions of this disease. We try to maintain prevention strategies, but the biggest thing that we can do, or the biggest development that has touched down on our shores recently, is the availability of vaccines. The good news is that Guyana is the leading vaccination country in all of CARICOM. Right now, there's no excuse and there's no reason for people in Guyana to not take a vaccine because of availability. The vaccines are available, and a lot more vaccines have been purchased recently. I believe the last thing I saw was 600,000 doses of the Sputnik vaccine being purchased for the people of Guyana, sufficient to achieve herd immunity if everyone who is eligible for the vaccine were to agree to get the vaccine. It is my personal opinion that everyone who is eligible for the vaccine should take the vaccine. But remember, we live in a free society and it is still a matter of choice. But I want to encourage those who are eligible to take the vaccines. There's only one group of persons who should not take the vaccine, and that is the group of people who have a known severe allergic reaction to vaccines or any component of the COVID-19 vaccines. That is the severe allergic reaction patient. Patient who would have needed to go to the emergency room because of an allergic reaction, who would have needed adrenaline, who needed breathing support, admission to hospital, etc. That's the kind of severe allergic reaction I'm talking about. And that's a very small group of persons. I believe it would be less than 1%. So everyone else 18 and above in Guyana would be eligible for the COVID-19 vaccine. And I want to encourage you, those of you who are eligible, to please go and take your vaccines. So people are asking, I want to know what happens after they get the COVID-19 vaccine. And as we speak now, almost 180,000 of our residents and citizens would have received at least a first dose of the COVID-19 vaccine. So on a gross numbers basis, that is the most in the entire CARICOM, 180,000 doses of vaccines delivered to the people of Guyana. What happens when you get your COVID-19 vaccine? Well, it is important to note that the vaccine actually protects you from severe COVID, and it makes the disease less severe. When I say less severe, you wouldn't end up in the ICU, you'll not end up on a ventilator, you'll not end up dying. And most recently, evidence has emerged that getting the COVID-19 vaccine, particularly the AstraZeneca or the Pfizer, these are the ones that were studied, that people who got these vaccines were less likely to transmit the COVID-19 infection from person to person. So that is an additional benefit. Not only does it protect you from severe COVID, but it reduces the transmission of the disease from the vaccinated person to the unvaccinated or those around them. And this effect is seen even if you would have had one dose of the vaccine. Of course, both of those vaccines that are studied, the Pfizer as well as the AstraZeneca, require that people get 2 doses of the vaccine. And in the case of the AstraZeneca vaccine, we recommend that the vaccine is given at least 12 weeks apart. Pfizer started out by giving the vaccine 21 days apart, and now there is emerging evidence that it is better if you delay it again up to 3 months. So that is also something to bear in mind. As we get more and more or deeper and deeper into this pandemic, evidence keep emerging, and we will tailor clinical practice and recommendations accordingly so that people can make the best choices and have the best evidence to inform them when they're making those choices. Most of the side effects from the vaccines after you receive it are mild, and they will go away in a couple of days. My personal side effects were fever, chills, and pain at the injection site. And within 24 hours, all had gone away. Of course, I took some Panadol during the night, and that was very helpful. So the next thing that people ask themselves, they just got the COVID-19 vaccine. So now what? What is the next thing? Well, we still recommend that you wear a mask. You wear your mask, you maintain social distancing, which is about 6 feet apart, especially when in the company of people who are not usually part of your social circle. You should avoid crowds and continue to wash your hands as often as possible. After the first dose of the vaccines that we have available here, plan and know when your second dose will be available. That is very important that you mark that day in your calendar and to be able to go when it's your turn. Now, it is oftentimes not realistic, and not everyone goes the exact date, but a day or two before or after is still recommended. It is still recommended that you get your second dose in the general time period around where you were scheduled. All of the vaccines that are available in Guyana require a second dose for you to get full protection. And if you have any major side effects that you're worried about, then you should contact the Ministry of Health or your nearest healthcare provider to make sure that these are reported. Now, what are major side effects that people should worry about? We have not seen any major side effects in Guyana, so we are very thankful and very grateful for that. But major side effects when it comes to COVID-19 vaccines are few. But the ones that we look for more so is the clots that are associated rarely with the AstraZeneca or Johnson & Johnson vaccine. And those clots are not common clots. They're clots that are found in the brain or somewhere near the liver. And if it's in the brain, it usually presents with severe, terrible headaches that last for days. And if that should occur, then people can seek medical attention. But not everyone with a headache means that you have a clot in the brain. So if you're someone who gets headache on a regular basis, you will recognize that there's different types and severity of headaches. So that is one thing to be on the lookout for, especially if the headache is not being relieved with regular pain medications. A lot of people use Panadol, they use ibuprofen or Motrin, Advil. These are things that are very helpful often with people who have headaches. across the world, there are people who have several reasons for not taking the COVID-19 vaccine. And even in developed countries across Europe, there are some remarkable reasons that people have put forward. So if one were to look at what are the common reasons for people not taking the vaccines, you would see that a number of persons, almost 25% of them, think that the vaccines may not be safe enough. And this is despite more than 600 million doses of vaccines being administered across the globe. Think about that for a moment. 600 million doses of the vaccines that were given. And so far, we have not seen any major unifying underlying side effects. There is no, common reports of, okay, all of these people are developing this, or many numbers are developing X or Y symptoms. So, and if that was the case, you would have already seen it being published, not just in the scientific medium, but also in all of the social media groups, all of the chat groups, etc. You would see this unifying theme of all of this common side effect. So over 600 million doses of the vaccines have been given, but we have not been seeing, common underlying major side effects to underlie these vaccination programs. Some people, about 20% of them, are concerned about side effects. And surprisingly, about 15% of people not taking the vaccine believe that COVID is not dangerous. And that is shocking, because we have over 3.5 million people now who have died from COVID-19 infections. So it is quite shocking that people believe that this is not a severe problem for their health. There are some people who reject vaccines based on principle, and those are people's personal choices, and they make choices and they have to deal with the consequences as they arise. And then a smaller percentage, about 10% of people, believe that it is best to let nature take its course. So those are the common reasons that people have put forward for not taking the COVID-19 vaccine. In terms of the side effects that accompany the COVID-19 vaccine injection, it is quite important to understand that when the side effects do occur, they are usually mild. It is extremely rare to find severe adverse reactions or side effects from these vaccines. The most common milder side effects seen with the COVID-19 vaccines include things like tiredness, pain or swelling at the injection site, fever or chills, and mild headaches. Usually these symptoms are common with any type of vaccines, not just COVID-19 vaccines. If you have had your flu vaccine, if you've had your hepatitis vaccine, any other vaccine that you would get, anytime there's an injection, you will have pain at the site of the injection. And a lot of these vaccines, they promote immune responses almost immediately. And therefore, when this immune response is being experienced, people tend to have some fevers, they tend to have chills. And so this is not anything unique to the COVID-19 vaccine, but it can be seen across all vaccines as we get them. The major thing that we worry about is blood clots that people have reported in rare, very rare instances with the AstraZeneca vaccine and the Johnson & Johnson vaccine. But it's important to note that with the COVID-19 infection itself, that there is an increased risk of blood clot. In fact, 30% of COVID patients admitted in an ICU can develop blood clots. and 81% of all thrombotic complications and the most common observed in COVID-19 patient is blood clots in the lungs. So I hope that this would help us to understand again more about the vaccine, the side effects, what to worry about, what not to worry about, what to expect after getting the COVID-19 shot. And remember, if you have any questions still, if you have any comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me. Until next time.